Check the description below for free resources that you might find helpful.
What do you call a condition or illness that lasts 6 months or longer? A. Acute. B. Chronic. C. Extended. D. Occasional. The answer is B. A chronic illness generally lasts 6 months or longer, or it occurs again and again. For example, COPD or back pain. A catastrophic reaction occurs when a person overreacts to a non-threatening situation. A. True. B. False. The answer is A. True. It's common in patients with Alzheimer's disease. Reactions could be as follows: yelling, hitting, refusing care, or even crying. Triggers could be due to a new caregiver on the unit, a change of routine, constipation, or too much noise. RAD is the abbreviation for A. Respiratory airway disease. B. Rapid airway disorder. C. Reactive airway disease. D. Radical anterior deviation. The answer is C. RAD. Reactive airway disease is an informal term used to describe asthma-like symptoms that do not have an exact cause. Symptoms include coughing, wheezing, shortness of breath, and tightening of the chest. Allergies, bacterial infections, smoking, and overexertion with exercise are a few causes. A course of action that should be taken every time a certain situation occurs is known as A. Procedure. B. Chain of command. C. Policy. D. Intervention. The answer is C. Policies are meant to establish clear expectations and guidelines for all resident care situations. For example, CNAs should never perform a task outside their scope of practice. For instance, a CNA should not insert or remove a Foley catheter. It's important to always know where the facility's policy and procedure book is located. Which is not a resident's right? A. The right to complain without retaliation. B. The right to pay their medical bill. C. The right to have visitors. D. All of the above. The answer is B. The right to pay their medical bill. Paying a medical bill is not a right, it's a responsibility. Any healthcare worker who violates HIPAA laws can be fined and/or jailed. A. True. B. False. The answer is A. True. HIPAA laws are taken very seriously when it comes to patient safety and privacy. Yes, violators can be fined up to $1.5 million and/or jailed for up to 10 years. Mr. Smith, a resident who is assigned to you today, is unable to reposition himself independently. How often should you turn and reposition him? A. Twice a day. B. At least once. C. Every 3 hours. D. Every 2 hours. The answer is D. Every 2 hours. Residents or patients who cannot turn and reposition themselves run the risk of pneumonia, pressure sores, muscle atrophy, contractures, UTIs, and constipation. Failing to follow the turn schedule constitutes neglect and may serve as grounds for termination. Locking a patient in their room is what form of abuse? A. Involuntary seclusion. B. False imprisonment. The answer is A. Involuntarily separating a person from others against their will is involuntary seclusion. It is a form of abuse and must be reported. What is the appropriate step to take if you make a mistake when documenting? Not electronically. A. Erase the mistake. B. Scribble it out with your ink pen. C. Use whiteout. D. Draw one line through it, sign or initial with your title, and date it. The answer is D. Drawing one line through the error with your identifying information not only keeps the document neat, but it also allows for easy visualization during an audit. All documentation should be done using an ink pen, so there will be no option to erase. Scribbling is messy and unprofessional, and whiteout is never allowed. You probably won't even find whiteout in the building. Your patient is lying face down. What position is this? A. Prone. B. Sims. C. Supine. D. Fowler's. The answer is A. The prone position, or proning, increases oxygen levels in those with respiratory illnesses by decreasing lung compression. This treatment is most commonly used for those with acute respiratory illnesses, including pneumonia. Which is not an example of an acute illness? A. UTI, B. Bronchitis, C. Diabetes, D. MRSA. The answer is C. An acute illness comes on suddenly and lasts a short time, usually days to weeks, but can be longer. Diabetes is a chronic condition that is long-term and requires ongoing treatment. Acute doesn't always mean easy to treat. The treatment for respiratory MRSA can be quite extensive. What type of information is based on something that was reported to you, but was not observed by you? A. Objective information, B. Subjective information. The answer is B. Subjective information. An example of subjective information is a patient holding his stomach and complaining of a stomachache. This information may or may not be true, but we must assess and treat it as if it is true. We can't actually see pain, so we have to rely on the information presented to us by the patient, i.e., verbal description, body language, and/or gestures. What is the best time of the day to take a resident's weight? A. After lunch, B. At bedtime, C. During activities, D. First thing in the morning. The answer is D. First thing in the morning, after the resident empties their bladder, preferably wearing pajamas or similar, each time the weight is taken. Objective information is collected by using your senses. Which of these four senses is not used to collect patient-related information? A. Taste, B. Smell, C. Touch, D. Hearing. The answer is A. Taste is the correct answer for obvious reasons. We can smell if a resident has had an incontinent episode. We can feel if a resident has a bump on the back of their head. We can hear if a resident is wheezing when they breathe. Miss Martha has watery, foul-smelling stool that contains blood and pus. What infection does she likely have? A. Diverticulitis, B. Irritable bowel syndrome, C. C. diff, D. Tuberculosis. The answer is C. C. diff, also known as Clostridioides difficile, is a highly contagious infection. It's spread by contact with infected stool and contaminated surfaces. Strict contact precautions must be adhered to. All sanitizing and cleaning protocols must be followed to avoid cross-contamination between residents, visitors, and staff. Which is not a symptom of shock? A. Cyanosis, B. Low blood pressure, C. Extreme hunger, D. Extreme thirst. The answer is C. Extreme hunger. Although the person may feel thirsty, it's important not to give them anything orally. If a person who is experiencing shock symptoms suddenly loses consciousness with food or fluid in their mouth, they could aspirate, which could lead to death. Aspiration is the inhalation of food, fluid, or foreign objects into the lungs. While at clinicals, you notice the care plan states a patient-resident is to be provided care in pairs. What does that mean for you as a CNA student? A. You must provide care for the patient and their roommate at the same time. B. You must have a staff member with you. C. The patient can remain in the same room with their spouse. D. You must have another student with you. The answer is B. Care in pairs is usually put in place for the protection of the staff due to frequent false accusations made by the patient. If you choose to provide care without a witness and the patient accuses you of wrongdoing, it then becomes your word against theirs, and you may be investigated. Depending on the outcome of the investigation, you could be removed from the facility pending investigation, or worse, not allowed back to finish your clinical rotation, which means your graduation date could be delayed. All accusations have to be investigated, even if we suspect them to be untrue. Who is least likely to experience chest pain during a heart attack? A. Women, B. Men. The answer is A. Women's heart attack symptoms can be more flu-like in nature. For instance, Women are more likely to experience nausea, vomiting, and body aches rather than the typical crushing chest pain that most men experience. Unfortunately, the atypical symptoms that females experience can sometimes cause them to be misdiagnosed. Always advocate for yourself. Don't take no for an answer if you feel something is wrong. Keep in mind that nothing is cut and dry. Symptoms can vary across the board. What is another name for vomiting? A. Enema. B. Emesis. C. Edema. D. Endoblast. The answer is B. The actual definition for emesis is ejecting or forcefully expelling stomach contents through the mouth and/or nose. I'm sure it's easier to just remember vomiting. Which is paralysis on one side of the body? A. Hemiparesis. B. Paraplegia. C. Quadriplegia. D. Hemiplegia. The answer is D. Hemiplegia is commonly presented as a symptom of an occurring stroke and can continue throughout stroke recovery. If the stroke affects the right side of the brain, paralysis frequently affects the left side of the body and vice versa. Hemiplegia can also be caused by a loss of oxygen to the brain, spinal cord injury, adverse reaction to medication, or traumatic brain injury. The symptoms can be temporary or permanent, depending on the severity of the damage to the brain.
Miss Nicole's CNA Test Prep Activity Book, Volume 1, is now available in digital format. Volume 2 is coming soon. Visit MissNicoleCNAStudyGuides.com.